live yet. There we go. We are now live. Hey guys, welcome back. I'm Dr. Jerry Cartsinell, a board-certified pediatrician who's been working in the field of autism over 20 years and pediatrics over 30 years now. And still loving it until I read stuff from my patients. Okay, to start off today's show, this patient of mine, we'll just call him Austin. And Austin has a story of having problems with his teeth. So I'm going to read to you, and I'll kind of kick off today's topic because I'm inspired. You know, when I get stuff like this, it just frosts me. And, well, let me read this to you. This is from the ER, and we were seen on 9/2. So September 2nd of this year. This just came into my desk. This is the ER summary of what they do and what they say. And Austin is a 22-year-old with autism. This is a 22-year-old male with a history of autism who presents to the emergency department with his mother with a concern for a fractured tooth and facial swelling. Austin mom states that she has been trying to get Austin into a special needs dental clinic here at the University of, and I'm not going to mention the name, since February. She's been trying to get her son seen since February. She states mid-July he fractured a left lower molar. A referral was resubmitted at that time and they still have not been able to be seen. She has tried calling multiple dentists in the area who will not see him. Great, huh? Last night he developed left-sided facial swelling that worsened today, so she presented him here in the emergency department. She's been giving him Motrin 800 milligrams around the clock, so she's not sure if he's had fever. He's not been eating since yesterday. So instead of being able to do preventative medicine, we have to wait until there's something critical going on that could even become life-threatening, because bacterial infections of the soft tissues of the mouth can become very, very serious. So let me tell you what they did, because I know everybody wants to go, well, how did this turn out for him? Well, in the physical exam, he's a 22-year-old male sitting comfortably next to his mom. He has normal head. Facial exam reveals swelling at the jawline. There's no lip swelling, and there is tenderness. Okay, they were only able to do, obviously, a very limited look into the mouth. Okay, so what they have now is they have an abscess in the cheek or the gum that they have to figure out. And we'll get back to this story in a little bit. So what we're going to talk about is teeth. And Austin's case is not unusual. I have another case, Joseph, and let me see if Mom's looking at this yet. No. Joseph also is waiting for repair. Mom cannot get repair of the teeth. She sent me a picture of his tooth, and it's got like a giant hole. I mean, you know, how many times have you seen a cavity before? When you can see a cavity that's drilling down like we're drilling for oil, like we're fracking, it's a big one. And when you have aggressive behavior, behavioral changes, not being able to sleep, pacing, screaming, yelling, aggression, one of the things that I like to think about is like, well, is there something going on in the mouth? You see, the mouth, like the feet, if there's not a problem, you're not even really aware of it until there is a problem, and then you're very, very aware of it. All right, so we'll get back to Austin's case. I'll tell you what they did in just a minute. But I did make a note of things that I see in my clinic that do pertain to the teeth. So on the top of the list is teeth grinding. Grinding the teeth. The fancy name for that is bruxisms. Bruxisms. And that is the fancy name for grinding your teeth. They can grind their teeth at nighttime, they can grind their teeth at the daytime, they can do it all the time, but it's teeth grinding. Generally, when I see teeth grinding in my clinic, it's a way of the patient telling me, I got something going on in my bowels, something hurts down here. And that could be anything from constipation to parasites to abnormal overgrowth of bacteria, diarrhea, inflammatory bowel disease, anything that causes pain in the gut very commonly causes the teeth to grind. Okay, very rarely do I have teeth grinding that's not as a result of something that's happening below the neck, something painful going on. But it can be, especially if it's your teeth that hurt. Okay, so teeth grinding. So when I see teeth grinding, I am going to look at the bowels as well as look inside the mouth if I can. All right, and the bowels are usually constipation, usually bacteria, and or yeast or parasites, and inflammation in the bowels. So we'll do a good bowel exam and then fix that, and the teeth grinding will go away. Dental decay. That's another thing that I see. Our kids are not good brushers of the teeth, and there's a lot of reasons for it, whether it's a sensory thing or an unwillingness to brush the teeth. And for whatever reason, they just have a history of poor dental hygiene. So if we can brush teeth, whether it be the manual or the electric, now the dentists are telling me that especially for our kids on the spectrum, the electric toothbrush is better, but it can be too sensory involved for some of our kids. They don't like the feel or the sound or the vibration, but it really is a good way to get the kids to brush their teeth if you can. And we use here in our office a silver gel, silver toothpaste. It has no fluoride, it has no SLS, sodium lauryl sulfate. It doesn't have anything in there except an antibiotic silver that actually gets into the gum line of the teeth and also coats the teeth so as to kill the bacteria that are responsible for cavities, because it is bacteria that are responsible for cavities. Many of the kids, if not most of the kids that I take care of, if they've had bad diets, they don't have bad diets anymore, because we've talked about that. There's no sugar, there are no gummies, there's no... Okay, so these kids are on pristine diets. Many of you guys have worked very hard to transition your children to gluten-free, dairy-free, low sugar, grass-fed beef kind of diets, so we don't have that lingering sugary stuff that the majority of untreated kids have gravitated toward, the cookies and the cakes and the donuts and the sodas. Still, really, sodas are being utilized to give to our kids. So anyway, good hygiene in the mouth starts with changing the diet, but most of you guys have done that. I'm real proud of you, because that's really a hard thing to do. Brushing the teeth in one way or another. Now, my son Josh, he brushes his teeth, but then dad or mom comes in and does the buff-up job. He just doesn't have either the manual dexterity or the map of the mouth in his brain, so he doesn't quite know where to get everywhere. So we'll go in there, and at age 24, we still tidy up the mouth with the tooth brushings, okay? And again, we use the silver toothpaste, and in my clinic we use the silver toothpaste because of the fact that it's just good stuff in there, and I'm laying down an antibiotic. Okay, it's silver, so we're not going to get resistant to it. Okay, so, we have lots of people. Hey, Heidi. Hey, Jessica. And Jackie's joined us. Hey, Claudia's on. Christy is on. Let's see, is that it? That's it so far. Good. Well, welcome, everybody. So we're talking about teeth. And the next thing that I see with our kids, we've got the teeth grinding, the dental decay. And we'll talk about, we could actually talk about how do I fix the dental decay. Well, I don't do it. I wish I could, because there's so many kids out there who need to have a good doctor working with them. Unfortunately, we don't have a choice when they get a cavity. Now, the small, tiny cavities in the primary teeth, like with my son, you can watch. You don't have to drill, fill, and bill on those puppies, because they're going to lose them anyway. But if they're getting kind of deep, or if they're concerning for the doctor, then we certainly would want to take care of that. I will recommend using the white fillings. Okay, those are called. They're resins. Okay, and people say, well, what's in those? And well, it's safer than the amalgams. So whatever it is, it's the lesser of two evils. Okay, so you want to make sure that you tell them that you want the composites, the white fillings. You don't want any metals put into his mouth, unless they have to be capped. And if they're capped, it can be stainless steel. Okay, when we put our kids down for that, when they have to be sedated, we want to make sure that the nurse anesthetist doesn't use nitrous oxide. Okay, my kid went absolutely bonkers for 2 months after getting exposed to nitrous oxide for a dental procedure. He had an abscess in the gum. Okay, and the procedure went great. It was the next day, and the next 60 days were just a disaster. He became so obsessive compulsive, and it's because he has a methylation pathway defect and he couldn't process the nitrous oxide laughing gas well. So a lot of our kids have a problem there, so I wouldn't recommend that. Okay, so we'll fill the tooth, and we can polish the teeth. I don't put fluoride on the teeth, but we can polish them. And if we have teeth that are so inclined, we may even actually put sealant on it. Now, some kids will have to go to sleep, and like I said, we don't want to use nitrous. The safest sleeping medicine I've seen so far for our kids consistently is something called propofol. So I do recommend propofol for that. All right, next problem in the mouth is gingival overgrowth. That's the gums, and they kind of overgrow, especially if they're on some seizure medicines like Depakote. They will overgrow, and that can be a problem. So we have to keep an eye on that. Tooth discoloration and pitting. Oh my goodness, I see a lot of that. It's like I'm looking at these teeth and I have no clue why they're very porous and they're discolored. And I'll tell the parents, when you go to the dentist, see what they say. Well, the best I can find out is due to poor diet, poor absorption, poor mineralization of the teeth. There's a family genetic history too that may be involved, but they cannot develop the enamel well, or they can develop the enamel well, just the right minerals weren't around during the formation of that enamel. So that's why I want to put a lot of these kids on our calcium magnesium supplements and things like that to make sure that we are optimizing their absorption of calcium so we can get those secondary teeth that are forming while the primary teeth are still there. Another thing that I see in my clinic with the teeth is the timing of them either growing or getting rid of our primary teeth or the secondary teeth dropping in. And that's because the teeth are under the brain control. All that timing is under the brain. If the brain is not doing well, also known as autism, sometimes it doesn't control that well. It's the same reason why some of our kids' nails and hair don't grow, because that's also under neurologic control. Or tanning, also under neurologic control. And I have kids who won't tan, and then the parents tell me, once we do things right and the brain's improving and recovering, my child got their first tan, or I'm trimming their nails, or something wonderful, or we've lost our teeth. The 6-year-old teeth came out when they're 8, because the dentist is saying, we're going to have to pull these. It's like, oh my goodness, you pull them. It doesn't assure that the secondary teeth are going to move in, so we got to do a better job there. Now, the teeth can be affected by what our kids are chewing on, what they're picking their gums, because I've had kids who pick their gums. Or how about this, and maybe some of you have experienced it, where the kids pouch their food. They can, like a chipmunk, put food in the pouch between the gum and the cheek, and they'll hold it there for hours. Okay, so I call that pouching. All right, so now we've talked a little bit about nutrition. The supplements that I like to give are vitamin C and CoQ10. I find that those are our two best supplements for gum. If there's particular gum diseases, we can talk about different supplements, the things that are anti-inflammatory and all, but I'd like to know what's happening there. As far as the structure of the teeth, making sure they're getting calcium and magnesium, really important as they're developing. Getting them to a dentist is a whole different thing. Some of the dentists I would recommend going to feel very comfortable with children with special needs, and I really appreciate those dentists who will tell you that they don't feel comfortable in their clinic with special needs kids. That's just not their area of expertise, and they don't really want to do that, because the kids do really well with the TVs up in the ceiling, and they can watch their Disney shows or whatever during the procedure. We've had dentists work on my son just for routine, that I thought they probably had, magic pixie dust or something, because Josh was great in there. Now, even Josh tells us we can sit outside and wait for him while he goes back, and they can do their dental care there. So I'm really happy with that. So bottom line is we don't want to use fluoride. We don't want to use nitrous. We can use stainless steel caps. Um, Braces. That's very individual. Braces. What are we trying to accomplish? When they say we want to put braces on an 8-year-old, I kind of frown at that, especially with kids with special needs. I've had them put braces on, $5,000 worth of braces, and the kid will work on them and pick them all off by the next morning. Okay, so we have to make sure that the child is emotionally ready for the braces. I'd recommend maybe waiting till they're 12, 13, or 14. I know they want to get in early, and they're right if we have neurotypical kids, but I question that judgment on our kids with special needs. But they tend to do very well with braces, but you have to really get them prepared. Some kids, it's just not going to happen, and their teeth are going to be a little bit crooked, and their jaw lines, the teeth in the front will be off a little bit. Hey, if they get to an age later in life, then they can have an Invisalign, right? A lot of adults do that. They didn't have an opportunity when they were in their teens or preteens because parents didn't have the money or they didn't have the insurance coverage. So they can get them fixed at any time. So I think that's okay to do, is to wait, because I have kids who have stainless steel allergies and their throats can actually start getting swollen. Those lymph nodes, the tonsils can get swollen and stuff like that. So I'm not a big fan on necessarily putting in a rack of stainless steel for a child who maybe not ready for that. So that's our braces. And let's see, so I think that's it. Now let me tell you a little bit more about what happened with Austin. Okay, so for those of you who have just joined us, Austin is one of my patients, along with another patient of mine whose name is Joseph, and they have been having difficulty getting any help with their teeth even before COVID-19, but COVID-19 has made it almost impossible because many states have been calling this an elective procedure. But cavities and dental restoration is not necessarily elective. Mom has been trying since January to get somebody to see her son, making appointments, not being seen, turned down, whatever, to a point where the child's face actually started swelling. So at that point then, she went to the emergency room, and the emergency doctor saw him and said, wow, we've got an abscess in the cheek, which is very common, and it could have been in the gum, but we can't get that kind of evaluation. And the treatment for is an incision and drainage. When you have an abscess, you can't treat an abscess with just an oral antibiotic. You have to have an incision drainage, like popping a zit, okay? Except this is a big zit. So here's what they found. Finally, somebody looked under general anesthesia. They took the x-rays, they did the dental prophylaxis, which just means they cleaned the teeth, dental restorations to tooth number 7, 8, 9, 10, 11, 31. Incision and drainage of the left facial abscess, surgical extraction of teeth number 1, 14, 19, and 30. Worked on a retained root and a bony impacted teeth number 17 and 32. They waited way too long on this pumpkin. Okay. I mean, this guy. Well, but wait, my favorite, and I haven't had a chance to talk with Mom yet. They sent him home on Tylenol. Not Toradol, not something strong, just Tylenol and antibiotics, of course. So let's see, is there anything else? They talked about the oral hygiene was poor, moderate plaque, and they went in there and they debrided all of the scales, with that little zapper thing you may have had. So anyway, let's see, and they also said the caries on tooth 14 were actually penetrating the pulp. I mean, the bacteria were in the nerve root Oh goodness, what a mess. Okay. So anyway, that's why I wanted to talk about this. They sent him home on Tylenol, Motrin, Augmentin, and a mouthwash, and then said 6-month hygiene recall or sooner as needed. Problem is, who's going to see him? Mom couldn't get him seen the first 6 months of, or actually 9 months. I keep thinking, man, it's been 9 months since she started trying to get somebody to look at this guy's teeth. And this was at a major hospital university that they ended up at, and they were trying to work through their special needs clinic. Okay, so what I would recommend then is for our kids, they should be seen at least once a year, and if they need to be sedated or put on a benzodiazepine, which I approve of for a one-time, one-and-done kind of thing, you put them on some Valium or whatever the dentist wants to do, and get them seen, inspected, looked at. We don't have to get bite wing x-rays. I mean, it's kind of nice to do, but I don't want that to be a deal killer for getting our kids in there, because, you know, for me, doing bite wing x-rays makes me want to throw up. Okay, I've got a very good gag reflex, and you put those bite wings in, I'm going to find that's very obnoxious. So these kids are going to have a real problem holding still, and there's going to be motion artifact, and I'm going to move and stuff like that. So I don't want that to be a deal killer. If they're put under general anesthesia for cleaning, that might be a good time to get the x-rays if the doctor feels inclined to. I'm not a big fan of x-rays, but for our kids with poor dental hygiene and can't communicate with you, I think it's a worthwhile thing doing, and I'm not big onto that. All right, so let's take a look and see. Okay, so Julie, hey Julie, the dentist suggested our 9 get his back molars coated with a sealant. Do you agree? Yes. I think sealants are, again, you don't want to put anything foreign in your mouth, but when you talk about our kids and their dental hygiene and history of poor mineralization and stuff like that, picking the lesser of two evils, like the composite fillings or the sealants, I think if we can tolerate no fluoride, that's not a good one. But if we can tolerate the sealants, I'm good with that. I think that's a really good idea. I think the benefits outweigh the risks of using that. Okay, good question. Let's see here. Can we use stainless steel caps when we're chelating? The chelators don't seem to attract stainless steel, so it's been safe, especially if the chelating overall has been helpful. The chelators have a pecking order of which they like, and stainless steel is not one of the things they're attracted to. Okay, they're going to be attracted to, depending on what you're chelating for, mercury, lead, arsenic. Stainless steel doesn't fit that, so I think we can still chelate. Now, you don't want to chelate if you've got amalgams. Okay, if you've got basically the silver fillings that have a degree of mercury in there, you don't want to chelate. But you do want to chelate while you're getting those mercury amalgams removed. Okay, so that would be a good time to do it. So we're okay there. So that's a great question. Let's see here. Hey, Catherine joined. Hi, Catherine. It's good to see you. Hope things are going well for you in California. Do you recommend getting tongue ties released? The tongue ties are a problem with language and sometimes sucking and swallowing, and then later on. I think it's a good thing to do. They have a new technique now. I wish they had when I was doing general peds. It's a laser. They just zap it and it's gone. Boom, vaporized, done. So I think in the hands of somebody who knows what they're doing, getting those tongue ties released. Now, the question is, what do you expect to get from it? And a lot of people will say the reason that they're not speaking is they're tongue tied. No, that's not the reason. But it is later on going to help them be able to form their sounds better once they do start speaking. So I do like that. Let's see. And Adriana from Texas, hey. And let's see here. is the toothpaste that you mentioned OTC or prescription? It is over the counter. It is not a prescription medication. And again, it's I think, far superior than baking soda or any of the other Tom's toothpaste because they don't give you that antibiotic um, push that our kids need. It's a gentle. I mean, we're just using silver ions as the killing mechanism for the bacteria that get in between the gum line and the tooth. Okay, and they actually talk about that in adult literature that can lead to heart attacks. The heart attacks it's a little complicated, but the bacteria in the mouth can lead to a heart attack. Okay, so it's really important to keep good dental cleaning for us as well. So that's what we use. That's what I use for my teeth. Okay, getting through all of these. Claudia says, "Hi, Dr. Jerry. My son Bernie is 6 years old. He has teeth out last Saturday. His behavior is changing, a bad behavior." Okay, so Claudia, did he lose his six-year teeth, the little front ones? Usually it's the front ones below, and that's what came out, or they had to do an extraction. I'm not sure what you're talking about there. So maybe you can write back and let me know. All right. Jessica says, "Thank you for covering this issue with two young boys with ASD, 4 and 6, who have yet to be seen by a dentist. It is a concern for us. I don't know who will ever see them with major anxieties and unwillingness even to brush extensively at home." Okay, so there are dentists, and I don't know where you're at, but there are special needs dentists, okay? And you might want to just go to Dr. Google and email special needs dentists near me. Or you may go to a TACA website, TACA, and they may have somebody in your area that does special needs. Now, if you find a special needs dentist and you say, "My son has autism and has anxiety about coming to you," they know what to do because this is what they do for a living. They see special needs kids, and it's like, tell me something I haven't seen before. An autistic kid who doesn't want me to examine his mouth? Like, that's what I do for a living. That's kind of like what I do for a living. I examine them too. So he will have, or she will have, some wonderful tricks, and the tricks might include, some benzodiazepine or whatever just makes them very unanxious. I mean, you'll wish you could use it all the time, but I say it's not a good thing. There's a price for magic, but using it once in a while for a dental restoration is great. Coming in, letting them see it. If the kid is totally going just berserk, then the special needs dentist then is also going to be associated with a nurse anesthetist, and he might say, on Thursdays our nurse anesthetist comes in and we give them a mild sedation. They are out like a light, and those are kids that have to go in once a year. Now, those are the kids that also don't like to have blood work done. So I always say that never let a sedation, even for a tooth, for a cleaning, go without some blood work. And very often you can get a home phlebotomist meet you at the office, and as soon as the child is sedated, we can get lab work that we want. Child doesn't even know the difference. Okay, we've cleaned their mouth, we've drawn their blood, and life is good. So I'd recommend that. And again, if you are living in a little podunk town that doesn't have anything, then you'll have to arrange kind of a medical vacation to a next major city. But every major city certainly has dentists who do the work on special needs kids, because there are so many of them, and for them it's like a little gold mine, okay, kind of built-in patient following. So I'd recommend that getting done. Fortunately, if you're catching them early, like 4 and 6, I generally do not see horrific teeth in 4 and 6-year-olds, okay, especially if they're on the gluten-free, dairy-free, low-sugar diet and they're not drinking sodas and juice in bottles. Then they're going to be doing okay. So you have a little time to get it done. And then if their teeth are like stellar and you're like, gosh, I wasted all my money, the teeth were all perfect, they got sealed or whatever, then maybe it's an every 2-year thing. On the other hand, if there's genetic predisposition for cavities, where mom and dad had mouthful of cavities, I didn't get my first cavity till I worked at McDonald's, and I discovered soda, because we didn't have soda when I was a kid because it was expensive. and you got to drink all the free soda you wanted. And I discovered something, and at 16, this is amazing, right? You guys remember orange soda or grape soda? At McDonald's, they had orange soda, and it was like fabulous. Okay, so I got my first cavity after working at McDonald's. Okay, it's the sugar. Okay, good question, Jess. Um, let's see if there's any more questions. This seems to have been a great topic. Let me go down here. Okay, so let's see. There's some more questions coming in. Right, so we talked about sealants. Okay, what do you recommend for healing if our kiddos are put on antibiotics after dental work? Um, Pretty much, the probiotics, just like if they had to go on an antibiotic for other reasons. I like using the probiotics. I think that's kind of important to keep them on it. And generally, dentists are really good with antibiotics. They only give 5 or 7 days coverage. They don't put them on for 3 weeks. If it's for a long time, then there may be more of a problem like an abscess. Okay, but even this guy with the abscess was put on augmentin twice daily for 7 days. So it's not like they're going to overdo it. They don't overdo it. Doctors don't. Okay. Alrighty. Let's see here. Toothpaste name, please. All right, guys. It's made by Silver Biotics. Ding, ding. Silver Biotics tooth gel. Like I said, we have it here. And it's fabulous. Fabulous. Okay, so Amy's on. Hey, Amy. When is an X-ray okay for son's teeth? Son's teeth are fine. He has yet to have an X-ray on teeth at age 5, but they keep pushing since they don't have any yet. His teeth are fine. His gums are fine. You can brush. I'm okay with not getting X-rays. They start getting cavities. They have teeth pain. Then I'd say, especially for the kid that you can't get into his mouth, you can't brush his teeth very often, or it's real cursory, it's just a chick and you're done and he won't let you do anymore. Those are kids who I'm going to be very careful about the cavities between the teeth or below the gum line. But if he's got healthy teeth, healthy gums, he's 5 years old, they want to do an X-ray every year. And it's like, 62, I've had a ton of X-rays. They've never found anything. I go to the dentist, he says, we want to get an X-ray. I said, we've got 55, 60 years of X-rays and nothing's been shown. Why do we want to do one this year? I'll let you know if it hurts. So I'm a little slower on my 5 and 6 year olds with healthy teeth. I'll wait because those teeth are going to go away anyway. Okay, they're going to go away anyway. They're going to pop out and you're going to get secondary. So we may be a little bit more careful with our permanent teeth, but for these primary teeth in a healthy mouth, I'm going to be a little more resistant to doing that. Okay, and very cool. So that's all of our questions. What a great topic, right? Teeth. Who talks about teeth these days? And it's like, there I'm going wondering, what am I going to talk about today? And then I get this coming through my email. I know what I'm going to talk about today. I'm going to talk about teeth. So if you have any topics that I haven't covered, because I went through all the topics I've covered, it's like, well, maybe I need to start repeating. But anyway, if you have a topic that I haven't covered or you'd like me to recover and do a little more in depth, like obsessive compulsive behaviors or anxiety or whatever, please email us, okay? mendingnaturally@gmail.com. And let's see here. And I get these emails in and I'll answer the questions. Okay, so this is totally different now. Craig writes in, I have a daughter with autism. I was just wondering what would be the best approach to detox lead from a 5-year-old. She's very high lead and aluminum in her body. Can somebody that young have IV chelation? Yes, you can have IV chelation. I started chelating children in the early 80s because they were ingesting paint. They were living in public housing, and the public housing was painted with lead paint. And the lead paint was peeling, and they were eating it. Lead paint tastes like chocolate, so a hungry child finds out that they have chocolate on the windowsill. They're going to pick it, and eat it. Fortunately, lead is the easiest to chelate, and it also the chelator is really non-toxic. It's called EDTA, and it's oral. You don't have to give it IV. So from a money point of view, it's very, very safe to do. It's very inexpensive to do. I like to use urine toxic metals. Okay, so in my clinic, when I decide to chelate a child, I get 2 urines. Okay, this urine, I'm just going to pick a day, Friday. And this is the urine that the child pees out from, say, 9 in the morning to 3 in the afternoon. That's 6 hours of urine, 9 in the morning, 6. Okay, so that's a 6-hour urine. The instructions will tell you what to do. You pour off part of that, you cap it, you tell the guy how many ounces that the child peed, okay, and you send that off. Saturday, next day, I give the chelator. And in this case, it's EDTA for lead, okay, but I can use DMSA or whatever. I use EDTA. I give the kid the EDTA in the morning, like at 8 in the morning. And I start collecting urine at 9, just like I did on Friday. And I'm going to collect it all the way through 3 o'clock, 6 hours. I might use EDTA, I might use DMSA, but I'm going to keep using it. I'm going to do it at 8 in the morning, noon, okay, and I'm going to collect that urine. So Friday, 6 hours of urine without a chelator. Saturday, 6 hours with a chelator, because I need to show you that I can remove the lead. So the report comes back and says, you know, the lead level on Friday was that big, okay, just a little line. But on Saturday, it was like off the chart, you know, it was in the parking lot somewhere. So I know that I can use the chelator, and it's working for her. So then I will chelate every other week, maybe some kids, depending on how they're doing every week. Just 3 days on, 4 days off, 3 days on, 4 days off, and we chelate. And every now and then, maybe every 2 or 3 months, we get another urine. I don't have to do pre and post. I just do the during the chelation, and we'll chelate that way. The good news, if it's lead, it is the #1 cause of reversible mental retardation. That's what they called it, okay? I don't know what they call it now, reversible intellectually challenged child. But the key word there is reversible. You remove the lead, they get better, okay? Mercury, that's a lot tougher, okay? Aluminum is hard to chelate too, and it's hard to demonstrate that you actually have aluminum. But lead, easy breezy. Let's work on getting lead out. Good question. All right, let's see here. Do I have any more here? Okay. And thank you. You're welcome. Great. So glad to hear from you. Do chelation. That's Janine. All right. So one more question and then we'll go. This is from Patricia J. Hi, Patricia. I know without knowing my child, you can't give me a definitive answer. I'm looking to contact your office for a new patient appointment. In the meantime, I'd like to start making some small dietary changes and add some basic supplements. My question is, I want to purchase your vitamin and mineral supplement and saw your Mending Natural capsules were specially formulated for children with ASD, and that you have the KH vitamin mineral powder capsules. Okay. So I like, depending on what your child can do, I like the powder, the Mending Natural multivitamin and mineral, okay, because it really makes up for a lot of the things that the kids don't have or take in. My last patient before the show ate a little chicken, a little beef, ate green beans for vegetables, very little fruit, maybe bananas and strawberries, and the rest were salty crunchy. No omega oils, no vitamin D, no calcium for the teeth or the bones, okay? So this is a start, okay? And so I'll go ahead and put that child on a good multivitamin. If I have a child who can swallow capsules, I got it. Or if I have a child who the parents would like to have the convenience of the capsule, just open it and dump it into something, that's great. So I do like our vitamin mineral powder that we have formulated here for our kids. And so if the child's not swallowing capsules, we'll make the powder. If the child is swallowing capsules, then they can swallow away. And you're right, vitamins make you very nauseous. And my son is a little verbal. I'm worried he wouldn't tell me right away. That's why we start with a really small dose, okay? Because you're absolutely right. If I take too many vitamins, it hurts. I agree. It just doesn't feel good. For my wife, it was vitamin B3. I had to buy each individual vitamin to find out which vitamin made her nauseous or upset or stomach doesn't feel good. So I think it's very important to start itty bitty. So for a child, I don't even know how old your child is, but say, for example, a 5-year-old, I would recommend a teaspoon twice a day of our powder, our vitamin mineral powder, but I'll start maybe with 1/8 of a teaspoon twice a day just to make sure the child does okay with that. Good question. All right, I think that's it. Any more questions here? No more new questions, so we are set for the day, for the week. And gosh, this was fun. I'm glad we had an opportunity to talk about teeth because nobody ever does. I hope this was informative for you. Have a great week. Country is starting to open up slowly. I might actually even be able to take my wife out for dinner tomorrow night, with Josh, of course. And just make sure you have some time out for yourself as well. And guys, have a great week, and I look forward to talking with you guys next week. Alrighty. Be well. Bye now.